Fear occurs in two primary ways. Learned fears, which can be defined as a learned pattern of fearful behavior in response to certain things, situations, and circumstances. In other words, learned fears are risks we learn to be afraid of. And instinctive fears, which can be defined as an innate fixed pattern of fearful behavior in response to certain things, situations, and circumstances. In other words, instinctive fears are risks the body automatically and involuntarily reacts to. Most of our fears are learned. Examples include becoming afraid of certain people, certain animals, birds, insects, locations, events, etc., the dark, speaking in public, lightning, being sick, developing a medical illness, developing a mental illness, dying, death, and so on. It's not that we were born afraid of these things, but that through experience, we learned that they were dangerous or had the potential to be dangerous because they could cause us or something we care about harm or unwanted unpleasantness. Whenever we become afraid of something, we establish a fear that the fear center of the brain, the amygdala and other parts, instantly remembers and stores for future reference. Then, whenever the brain recognizes things, situations, and circumstances it has identified as a threat, it immediately alerts us to the danger. The more often we encounter the same threat, the faster and more automatic the brain alerts us. Consequently, we'll be anxious whenever we think we are in danger. The more fears we establish, the more often we'll be anxious. Learned fears are a common cause of overly anxious behavior that leads to issues with anxiety. Instinctive fears are automatic, innate fears. They trigger whenever the brain senses an instinctive threat. Examples of instinctive fears include the fear of annihilation, which is the fear of death and ceasing to exist. The fear of pain and suffering, which is the fear of being injured or losing bodily function, causing pain and suffering. The fear of loss of autonomy, which is the fear of losing one's freedom, such as being restricted or immobilized in some way. The fear of separation, which is the fear of being rejected and abandoned, causing loss of love and acceptance. And ego death, which is the fear of being humiliated, causing the disintegration of one's constructed sense of lovability, capability, and worthiness. Instinctive fears are hardwired into our being or learned at a very early age, such as while in the womb. Nevertheless, most of our fears are founded on these 5 instinctive fears. However, just because we establish a fear doesn't mean we're stuck with it. We can eliminate learned fears. For instance, fear extinction occurs when we eliminate fear by teaching the fear center of the brain that the thing, situation, or circumstance that was once perceived as a threat no longer poses a threat. There are many ways to extinguish fear, such as through cognitive therapy, exposure, memory reconsolidation, and so on. However, working with an experienced anxiety disorder therapist is the most effective way to identify and extinguish fears. Extinguishing fears eliminates anxiety issues. That's because if you don't feel threatened, you won't be anxious. Consequently, no one needs to feel stuck with unhealthy anxiety. Doing the right work can eliminate problems with anxiety.